Good morning, and thanks for joining us. We're going to give folks just another minute or two to gather, but we really appreciate you being here with us. Now is your time to grab a cup of coffee before we settle in and get rolling. All right, I see people joining us slowly but surely, so we're going to give it just another quick minute. Okay, we do have a lot of content to cover today, so I am going to dive in. I expect we'll have a few more people joining us as we move through the morning. But good morning and welcome to Eggheads, the Colorado Health Institute's monthly webinar series. Before I start, I want to let you know this session is being recorded, and we're also providing Spanish interpretation services. To help get that set up, I'd like to introduce Indira Guzman from Community Language Cooperative, who will walk you through that process.
Gracias. Good morning, everyone. My name is Indira Guzman, and I'm here with the Community Language Co-op. This morning, the organizers of this event have made a commitment to language justice. What that means is that we want everyone to engage and participate in the language of their heart. So in a second, we're going to turn on interpretation. We're going to ask you to please select the language that you prefer to engage in. There will be an interpretation icon on the bottom of the screen. When we turn it on, click on it and select either English or Spanish. I will be interpreting into English and Spanish. I am going to repeat this in Español and then we'll get started. Muy buenos días, mi nombre es Indira Guzmán y estoy aquí con la Community Language Co-op y esta mañana los organizadores de este evento han hecho un compromiso a la justicia del lenguaje. Lo que esto significa es que queremos que todos participen y se comprometan en el idioma de su corazón. Entonces, para esto vamos a prender la interpretación. Va a haber un icono terráqueo que dice interpretación. Por favor, seleccione el idioma que prefiere participar. Si tiene preguntas o dudas, no deje de mandarme un chat y yo le ayudaré a acomodar eso. Si está en su celular o su tablet, busque las opciones de 3 puntitos o de más y ahí encontrará los ajustes de interpretación. Muchas gracias. Let's go ahead and turn on interpretation.
Thank you, Indira. For those of you who are using the Spanish interpretation this morning and would like to see the slide deck in Spanish, my colleague is sharing that in the chat right now, and you can download it and use it to follow along. We've also activated captioning for speaker remarks, which you can activate at the bottom of your screen. Just click the CC button. To adjust the size of the captions, click the up caret next to show captions and select subtitle settings. Then under closed captioning, move the slider to adjust the size. We'll save time for questions at the end of the presentation. That said, if you have questions throughout the presentation, please drop them in the chat or the Q&A and our team will respond as we're able. I'm Christy Ariano, Managing Director of Marketing and Communications at the Colorado Health Institute. Today's Eggheads webinar will highlight 2 community ambassador programs run by the Metro Denver Partnership for Health. Next slide, please. Or MDPH. CHI facilitates MDPH and acts as the central coordinator of the ambassador programs. One program is focused on immunizations. The other is on mental health. This webinar will describe how the community ambassador programs worked and the lessons learned about partnerships between public health and community-based organizations. Again, thank you for joining us. For those of you who were with us last month, you may remember that I like to chat a little bit at the beginning. And just to get the conversation going, I asked people what they were looking forward to the most about fall. I'll admit I was a little bit surprised, but the answer we heard most was pumpkin spice lattes. For me, it's the leaves. So I want to stick with that theme. And so this time around, I'm asking for your suggestions for your favorite autumn leaf viewing spots in Colorado. Drop your suggestions in the chat. Bonus points if they're a short drive away. I will say I was on Independence Pass just this weekend, and the leaves aren't quite turning. So checking the Golden Gate Canyon, that's a close one. I give points for the proximity on that one. Kenosha Pass is very popular. Gold Camp Road in Colorado Springs, North Crestone Lake. I know what I'm going to be doing for the next few weekends. Not close, Sangre de Cristos, but definitely beautiful. Thank you, Kat. Guanella Pass, a lot of Guanella Pass. Thank you for your suggestions. I really will be downloading these and taking some road trips. Next slide, please. I hope most of you know a little bit about CHI, but for those of you who don't, CHI believes that good health policy leads to a healthier Colorado. We're an independent, nonprofit health research and consulting organization. Our public-facing or public benefit work is funded by generous philanthropic supporters, including the Colorado Trust, Caring for Colorado Foundation, Zoma Foundation, and the Colorado Springs Health Foundation. We're so grateful for their support. We also consult with organizations, including community groups, providers, state and local government agencies, and foundations to provide not just analysis and data, but strategic planning, facilitation, complex modeling, evaluation, and strategic communication. In fact, the work we're talking about today through the Metro Denver Partnership for Health is an example of this type of work. If your organization is ever interested in partnering with us or learning more about how we can support your work, please reach out. Next slide, please. Let's dive in. You're going to hear from my colleagues, Nicole Weber, Emily Santich, and Rachel Boyer. Additionally, our colleague Guadalupe, along with a few members of our communications team, will be chiming in on the chat to help respond to questions and provide resources. And with that, I'll hand it over to Nicole.
Thanks, Christy. Hi, everyone. I'm Nicole Weber, and I help lead the Metro Denver Partnership for Health, which we're going to talk a little bit about today, and how we partnered with communities, specifically community-based organization ambassadors, to advance health. Before we end our presentation today, we hope you leave here with 3 key takeaways. The first takeaway is involving community as trusted leaders to help tailor messages that are culturally relevant can improve health outcomes. Secondly, participating ambassadors in our program improve their confidence and knowledge in promoting vaccines and positive mental health. And finally, flexibility, continuous learning, and adaptation were keys to ambassador program success. Before we jump into a little bit of our background, I want to talk about the Metro Denver Partnership for Health, or MDPH. MDPH is a collaborative of key stakeholders committed to improving health in Metro Denver through regional action. MDPH is led by the local public health agency partners, serving the 7-county Denver metro area. That includes Adams, Arapahoe, Boulder, Broomfield, Denver, Douglas, and Jefferson counties. In the chat, I'd love for you to drop in how many people do you think these 7 counties cover? And we'll take a little poll in a second. MDPH also includes health systems and the regional accountable entity partners across the Denver metro region. The Colorado Health Institute is the administrative, coordinative, and fiscal hub of MDPH. So why do we work together? Health does not recognize county borders. We cannot achieve our mission of improving population-level health without strong multi-sector partnerships. Because of this, MDPH also works alongside regional leaders in human services, with behavioral health, community-based organizations, environment, government, and education to achieve its goal of promoting health and well-being across the region. In fact, I see 2 correct answers. Our work does impact over 3 million Coloradans, which is actually about 60% of the state's population who live in this region. Our vision is improved health in Metro Denver through regional collaboration, and we do that by building partnerships between our agencies and across sectors for achieving capacity in our vision. We will start today's discussion with a background and an overview of the model MDPH used to collaborate with community on our projects. This is just one model, and there are many ways to involve community throughout your work. Before we review the model, we want to set the stage for how and why we developed our programs. MDPH acknowledges that across the Denver metro area, the state, and the nation, segments of the population have been disproportionately impacted by COVID-19 and the economic impacts of the pandemic response. In fact, Coloradans who are Black, Indigenous, Latinx, and other communities of color, those with lower incomes, and individuals who lack documentation were at higher risk of severe illness from COVID-19. The circumstances of their lives, crowded housing, work environment, underlying health conditions, and limited access to care put them at higher risk of severe illness. Historic systemic racism and discrimination have also generated mistrust in the medical system and with vaccines specifically. And traditional vaccine distribution methods may have limited accessibility while we were rolling that out. MDPH developed guidance and strategies to guide COVID-19 response equitably and to meet the needs of these specific priority populations. Two examples are shown on this slide. One focused on vaccinations and the other on mitigation and prevention. A key recommendation of these reports was to build joint endeavors with partners who know and understand the issues of their communities, which led to the development of our Community Ambassador Program. This is the health equity involvement spectrum. It's used by many in public health and most recently adapted and adopted by the National Academy of Medicine. It shows the different ways to involve and share power with community, beginning with inform on the left side and progressing to defer to on the right. Different programming can take different approaches to involving the community, and it all really just comes back to your program goals. One of MDPH's shared principles and approaches for its work is to partner with community as shared decision makers to improve trust, address disproportionate COVID impacts, prevent future health disparities, and lay the foundation for future partnerships. The MDPH Community Ambassador programs utilize this specific health equity community involvement spectrum through which we aim to collaborate with community in planning and implementing decisions. The program includes partnering with community leaders to ensure health resources and processes are culturally appropriate and responsive to community needs and preferences. Our program lies on the collaborate level, that number 4, where we aim to promote community capacity in playing leadership roles and with implementation of decisions. Power sits with the community to direct interventions and strategies in order to build trust and partnerships. This includes within our meetings and how ambassadors chose to implement interventions and adapt materials. For example, ambassadors decided how to tailor communications to reach historically underserved populations with updated and accurate information. They then delivered this information as trusted leaders within their communities. These are our program goals. Ensuring community involvement is crucial to narrow the equity gaps we see in various health outcomes. In fact, implementing culturally relevant interventions is foundational to reducing health disparities and are also associated with better outcomes and more positive experiences with the healthcare system. Our goals are to reduce disparities by increasing capacity of ambassador organizations. We hope by increasing their capacity, we can build trust, increase ambassador and community confidence and understanding around immunizations and mental health, increase the likelihood ambassador organizations will partner with healthcare or public health partners to address challenges, barriers, and needs for future health topics. All right, Here is our overall model that NDPH has used to build long-term partnerships with community-based organizations. You will see many components that make up our overall approach. Each of these are key to centering equity and community involvement, and we're going to go through each piece. Before we do that, I want to start by discussing the overall structure you see here. When we note ambassadors, we actually mean community-based organizations and the staff that work there. NDPH partners act as liaisons to ambassador organizations to support ambassadors throughout the program. They are subject matter experts in their health topic or work, and they work in community engagement for the organization specifically. They have connections to the community already and helped us identify who are the trusted messengers across our region. So the first step to beginning our ambassador program was to understand what the community says are barriers to health and to understand what outcomes you want to work to address. This includes utilizing community engagement or community health assessment data to understand what your goals are. These ambassador program goals should also guide who you decide to partner with. Are there differences in outcomes between priority populations or different neighborhoods? And there are many other considerations, including current programming or capacity and priorities of partners when thinking about how to set up the program and begin recruitment of community-based organizations. In our model, we use an interview process and a snowball sampling method to recruit ambassador organizations. Once you've identified ambassadors, it's important to set the stage with an asset-based lens. Community-based organizations bring much to the table, and it's important to highlight facilitators and what capacity they bring to the work. They are leaders in their field and understand community attitudes and challenges. Although understanding barriers to positive health outcomes is also key, we also want to identify what they think is important to address these challenges specifically. Our liaisons developed a program plan with ambassadors to help them outline what strategies they want to work on. We promote them to leverage the connections they already have in the community already. So this could include existing strategies such as barbershop programming, their current social media presence, or utilize learning groups they already have in place. Next, supporting ambassadors throughout the process is a key component that must not be forgotten. This could be through communities of practices, individual meetings, or trainings. It's an important element of capacity building and also includes space to talk about culturally relevant support and training. And lastly, our goal is that ambassadors report interest in working with us for other future health priorities. As programming ends, consider asking follow-up questions or setting up closeout meetings to understand what did or did not work about the program. Follow-up is also very crucial so our partners know how you are using their input to improve your work. We will talk a little bit about outcomes in the coming slides and the ways to center ambassadors' feedback into your evaluation plan. Making sure to capture data that is important to the community is very important. Lastly, I have received multiple questions about how we finance the program and how much ambassadors are funded. We offer a menu of options, many ways to work with us, which allows flexibility in capacity and level of interest. To date, our ambassador organizations have received stipends ranging from $2,500 to $20,000 to implement activities depending on the program. Our program is currently funded by a variety of sources, including NDPH partners Centura Health, Jefferson County, Colorado Access, the Colorado Community Health Alliance, as well as the CDC Foundation and the State Health Department. Thank you so much to our partners for the wonderful work that they have been working on with this, as well as the donations to this program. Here is a timeline of our ambassador work to date. We first piloted our work in 2020, which you can see in the dark gray bar, and we're currently on the 4th and 5th iteration of the programs, and those are the dark blue and orange bars here. With this slide, an important component we want to acknowledge is that we have worked through many iterations. It's a new model for the region that includes establishing new relationships and building trust. It's important to go slow to go fast. We want to make sure that it works for everyone around the table and to establish long-term and trusting partnerships. I will now pass it off to my colleague, Emily, for an overview of our immunization ambassador model. As you're listening to her, think about how some of these best practices for working with community have actually shown up in your work. How can you incorporate some of the model that I just reviewed and upcoming real life examples into how you've considered collaborating with community? I'd love to see those ideas in the chat. In addition, if you're just joining us, we are going to re-upload the slides in Spanish to the chat now, so you can follow along if you don't have those. Thanks.
All right, thank you so much, Nicole. I am going to spend the next few minutes talking about the Immunization Ambassador Program, which is one of 2 ambassador programs through the Metro Denver Partnership for Health. And in this program, we worked closely with liaisons to recruit organizations for the program, and we prioritized partnering with organizations with close ties to their communities so they could serve as trusted messengers to share COVID-19 and flu vaccine information. And since its inception through the Immunization Ambassador Program, MDPH has partnered with 40 community-based organizations, including advocacy organizations, chambers of commerce, health centers, food pantries, and more. And across ambassador organizations, many populations that have been disproportionately impacted by COVID-19 were reached, including individuals experiencing homelessness, homebound individuals, mountain and immigrant communities, Hispanic, Latino, Latina communities, Black or African American communities, and those enrolled in Medicaid or without insurance. And here are a few examples of what ambassadors did throughout the program. They shared culturally relevant COVID-19 and flu vaccine information with their communities through a variety of communication materials, such as flyers, social media posts, newspaper and radio ads, and even movie theater pre-rolls. They disseminated these materials at tabling events, town halls, barbershops and salons, schools, malls, and even on WhatsApp and Spotify. Ambassador organizations also provided transportation to and from vaccine appointments to reduce barriers to accessing the COVID-19 vaccine. And they partnered with healthcare and public health providers to host vaccine events. And the key to all of these activities through the various communication strategies and events is that ambassadors found ways to meet people where they're at. They integrated COVID-19 and flu vaccine promotion into their existing programs and services and at various community events such as block parties, fairs, back to school events, and concerts. Here's an example from one such event promoting a block party with live music, beer, a vaccine clinic, and food trucks. And here's one quote from an ambassador that really highlights meeting people where they're at. The highlight of the month was being able to start up the WhatsApp group and have community leaders, as well as people of the community, give information to those who needed it. People are free to come and go from the group and ask for information on resources such as testing and vaccine sites, basic resources for utilities, and rent. This ambassadors community is active on WhatsApp, so they use this platform as an opportunity to share about not only vaccine resources, but also other necessary community resources. And by doing this, they created a trusting environment where people could access the information they need to make informed decisions about their health. And on the screen are a few examples of promotional materials developed by one of the ambassador organizations. The materials that ambassadors created really reflected the communities they serve in both the imagery and the language. If anyone on the call has examples of how you or your organization developed materials or conducted outreach in ways that reflected the needs of your community during the COVID-19 pandemic, we would love to hear about it. Feel free to share what you have found to be successful in the chat. And we'll also drop into the chat one resource that we've used, the Vaccine Resource Hub, which has accurate, community-tailored material about COVID-19 and flu vaccines. And the program has been and continues to be successful. Let's see, I think my view might be frozen, but thank you so much, Jackie. So the data that I'm sharing on this slide and the next few slides are all from the first year of the program, which ran from spring of 2021 to spring of 2022. And in that time, ambassadors established 42 new partnerships with local organizations, coalitions, and public health agencies, hosted 40 vaccine clinics, and hosted 29 community events, such as discussion sessions or town halls, community skill building workshops, and informational sessions or webinars where they promoted the COVID-19 and influenza vaccines. And in spring of 2022, ambassadors were asked in a survey to reflect on their current state as a result of participating in the program and how they felt before participating in the program. The survey measured understanding of barriers an ambassador's community faces to accessing the COVID-19 vaccine, their knowledge of COVID-19 vaccine resources, and confidence in their ability to support community members to get the COVID-19 vaccine. The survey also measured partnerships by asking ambassadors how much they partner or work with local public health agencies and healthcare partners, and how likely they'd be to work with these partners in the future to address challenges, barriers, and needs in the community. And I'll walk through some of these outcomes on the next several slides. The first program impact that I'll talk about is related to understanding barriers. Ambassadors were asked to reflect on their level of understanding of the barriers to receiving the COVID-19 vaccine that their community faces. On this slide, the top bar represents how ambassadors felt before the program, and the bottom bar represents how ambassadors felt after the program. The dark blue portion shows ambassadors who reported a medium level of understanding, light blue is somewhat high, and the green is a high level of understanding. And as you can see, before the program, 22% of ambassadors reported they had a high level of understanding of barriers to receiving the COVID-19 vaccine, compared to over half of ambassadors after the program. Ambassador organizations had many one-on-one conversations with community members throughout the program to try to understand barriers that exist to receiving the COVID-19 vaccine. Another program impact is related to knowledge. The percent of ambassadors who reported being knowledgeable or very knowledgeable about COVID-19 vaccine resources more than doubled before and after the program. Resource sharing, especially emerging and culturally relevant COVID-19 information, was both a goal and a success of the program. Another program impact is related to confidence. Ambassadors were asked to reflect on level of confidence and their ability to support community members to get the COVID-19 vaccine. And on this slide, again, the top bar represents how ambassadors felt before the program, and the bottom bar represents how they felt after. The dark blue portion shows ambassadors who reported somewhat low confidence, light blue is somewhat high, and green is a high level of confidence. Before the program, 2/3 of ambassadors reported somewhat high or a high level of confidence, compared to 100% of ambassadors after the program. Throughout the program, ambassadors had the opportunity to build skills related to having vaccine conversations and learn from one another about successes and challenges in promoting the COVID-19 vaccine, which contributed to the changes we see related to confidence. And the last program impact I'll talk about is related to partnership building. Another success of the program was creating and strengthening partnerships. As a result of the program, 78% of ambassadors reported that they would be very likely to work with public health or healthcare partners, compared to 33% before the program. And now I'm going to pass it to my colleague, Rachel, to talk about the mental health ambassador program.
Thanks, Emily. So following the success of the immunization program pilot, MDPH created a mental health ambassador program pilot. And the mental health ambassador program mirrored the structure of the immunization program, with liaisons from public health and healthcare partners, supporting the work of ambassadors from community-based organizations. Since the Mental Health Ambassador Program was made after the immunization program, MDPH was able to include some lessons learned from the immunization program. And this includes adding more types of program evaluation and data collection, as you'll see in the coming slides. Just like the immunization program encouraged community members to get vaccinated, the Mental Health Ambassador Program encouraged community members to have conversations about mental health. Mental health has long been a shared priority for MDPH. For example, MDPH supported the creation of the Let's Talk campaign, which is an online resource to help people learn about mental health and to empower them to have conversations about mental health with friends and family. The Let's Talk website includes a toolkit of messaging media, including the posters you see here on screen. Ambassadors were encouraged to use the Let's Talk material as a starting point in their efforts to talk to community members about mental health. In order to identify the priority populations in the region for this ambassador program, MDPH used data from the Colorado Health Institute's 2021 Colorado Health Access Survey. These two graphs each compare survey results from different demographic populations. The dark blue represents respondents who are white. The light blue represents respondents who are Black or African American. And the green represents respondents who are Hispanic or Latino. The first graph shows that Coloradans who are Black or African American and those who are Hispanic or Latino were more likely than their white counterparts to report not getting needed mental health services because they were worried what would happen if someone found out that they had a problem. The second graph shows a similar trend, where Black and African American and Hispanic and Latino Coloradans are more likely to say they don't feel comfortable talking with a professional about a personal problem. Given this data, MDPH prioritized the Black or African American and Hispanic or Latinx communities as the target communities for this program, meaning that ambassadors were recruited from organizations that serve these populations. In total, MDPH partnered with 6 community-based organizations for 6 months for this pilot program. Each ambassador organization was different and had their own approach to positive mental health communication and promotion. Organizations included health centers, promotora organizations, and even an artist collective. Through the program, ambassador organizations designed programming, interventions, and messaging specifically suited to their community. This produced a wide variety of interventions and approaches to talking about mental health. For example, some ambassadors organized small, intimate sharing sessions where community members spoke about mental health issues, whereas another ambassador participated in a large-scale radio broadcast campaign highlighting different mental health topics such as suicide prevention. More examples of ambassador activities include setting up information tables at mental health and COVID vaccination events and holding mental health first aid training classes. We'd love to hear from people on this call about any local mental health awareness events that you've participated in. As we're going along here, please feel free to drop in the chat examples of creative community mental health events or campaigns that you've seen recently or even helped build yourself. We'd love to see what's out there in the community. In addition to the mental health messaging and promotion, ambassadors gathered local data about stigma and mental health messaging through a community survey and focus groups. More on those data collection efforts later in the presentation. Here's just a few examples of some promotional materials developed by ambassadors. The materials ambassadors created reflected their communities in both imagery and language. Through all combined efforts, messaging, and events, ambassadors reached on average an estimated 4,700 people every month throughout the metro region with mental health programming and messages. Now you may be asking, what does adapting mental health messaging look like? Well, allow me to share a few examples. One ambassador found that when they asked people if they were interested in talking about mental health, many people were reluctant. This is because many people associated mental health with being, quote, crazy, nuts, or insane, end quote, and they did not want to be associated with these labels. In order to help people enter into a conversation about mental health, the ambassador developed the mantra, getting the help you need for mental health doesn't mean you're crazy. It means you're taking control of your overall health. Saying this allowed the ambassador to convince community members to have a conversation and to really get at the heart of the issue. Another example of adapted messaging revolves around approaching mental health from a self-care angle. A different ambassador found that people were not willing to talk about mental health, but they were open to hearing about self-care. The ambassador found that many community members had never heard of self-care and were enthusiastic about the idea once they learned about it. The ambassador used the concept of self-care as an introduction to ideas of holistic wellness, including mental health awareness. These examples demonstrate how valuable ambassadors are and how they can deliver mental health messaging really effectively. So now I'll switch gears and talk a little bit about the data collection that ambassadors participated in. So as part of the quantitative data collection element of the program, ambassadors administered a community survey to further understand stigma-related barriers associated with mental health outcomes. The survey covered many topics from perceptions of mental health to mental health resource availability. For the sake of time, I won't be able to cover all the various topics that we did in the survey, but I can give you an example of a finding. One finding from the survey was that most people view professional services as helpful, but many do not know where their local resources are or do not have local resources consistent with their beliefs and customs. This finding demonstrates the need for culturally responsive care and the importance of connecting people with providers who understand their background. Another component of data collection for the program was to gather community feedback on some of the messaging from the Let's Talk Colorado campaign. 2 ambassadors, one from each priority population, were contracted to conduct focus groups to test specific Let's Talk messaging. Again, for the sake of time, we won't be able to share all the results here, but I'll give an example message and some of the feedback we received. This message in particular was highly liked among focus groups. Work stress, money problems, or family worries can get anyone down. When you're struggling or feeling overwhelmed, don't go it alone. Talk to someone. The feedback from this focus group was that this message resonated with them because it relates mental health to everyday struggles. Other feedback from focus groups included messages they didn't like and ways to improve them. Focus groups also weighed in on ways to make messages more culturally relevant, suggestions for types of media to use to relay messages, and specific populations to target. If you're interested in more details on the focus groups, the community survey, or the mental health program in general, MDPH wrote a final report detailing the results of the Mental Health Ambassador Program, and we will be sharing the link with all of you in the coming weeks. Just like the immunization program, MDPH sought to measure how much ambassadors' understanding, knowledge, and confidence as it relates to reducing mental health stigma changed as a result of the program. Improving these areas, as well as the likelihood that ambassadors will partner with public health and healthcare partners, are key goals of this program. Ambassadors filled out an evaluation survey before and after the program to assess these outcomes. One of the findings from this ambassador survey was that as a result of the program, ambassadors felt like they knew more about mental health resource availability in their community and also felt community members were more willing to talk about mental health. Furthermore, the likelihood that ambassadors will partner with public health or healthcare partners improved, with more ambassador organizations indicating they were willing to work with these entities after the program. These results are promising, and they show that the ambassador program model benefits both public health partners and community-based organizations. And as MDPH continues these ambassador programs, we are proud to build on the successes that we have achieved so far and incorporate lessons learned. So I'll pass it back to Nicole to finish us out, and then also to review what some of those lessons learned are.
Hi, everyone. I can see my camera is just getting up and going, but I will start with my lessons learned. I might actually say lessons learning here. This is something that we are continuously learning as we move forward over the course of the next coming months as well. Great. There are a few that have stuck out. First, many organizations have noted that although it's important and effective to utilize culturally responsive resources, it's also crucial that referrals to providers or other resources are to organizations that understand the needs of the community themselves. This includes those that are trained in culturally responsive approaches or who are part of the community already. Next, take a whole incorporate programming into existing work, such as community events or tabling, is a great way to reach the community with your topics in a way that you're already connecting with them. Thirdly, ensure translation and interpretation services are in your budget is crucial. Although there are many ways to be culturally responsible, language is one important tool to doing just that. And lastly, the last two bullets are embracing variety and ambassador activities is very important. Ambassador organizations each had different programming capabilities, connection points to the community, and approaches towards delivering messaging, all of which resulted in a variety of activities. For example, some organizations conducted large-scale media campaigns, while others opted for small, intimate discussion circles. The variety of activities made it difficult at times for liaisons to gauge how ambassadors were doing compared to program requirements and expectations. It's important to anticipate and support a variety of activities and communication strategies from ambassador organizations without valuing one community engagement strategy over another. This is then also related to understanding program impact and evaluation. It's difficult to compare strategy outcomes when ambassadors implement diverse interventions. Flexibility and qualitative data are key, but what constitutes success should actually be dictated by ambassadors themselves. And this is an ongoing and continuous process. Lastly, we want to complete our presentation by reviewing some final additional considerations. As you've heard today, programs like the ambassador model are important in building sustainable relationships among local public health, healthcare partners, and community-based organizations. Community-based organizations have a wealth of knowledge about issues facing their constituents and can direct local situations and solutions. MDPH is considering how we can actually adapt this model for the program for the future. First, as you think about utilizing community involvement model, think about how different community needs might need different approaches. Our model is not a one-size-fits-all. We were lucky to have flexible funding to move this work forward, but there's also a need for more sustainable flexible funding to support CBOs long-term. Reporting and contract requirements can be burdensome on community-based organizations who are already pulled in so many different directions. Be intentional about how and where you're able to fund these programs. And lastly, if you're thinking about utilizing this model, make sure to coordinate with other community efforts that are occurring in your region or across your organization. Assessing how to best coordinate efforts and working with the community is one important next step for MDPH. All right. I'm going to work on my camera. I want to thank everyone for joining us. It's now time for a question and answer session. I'm going to hand it over to my colleague, Guadalupe Solis, to walk us through how to use the Q&A and the chat to ask us questions or to go off unmute. And she'll say hi, and then I'll try to get my camera back on to help with this Q&A session. Guadalupe.
Hi, thank you, Nicole. Good morning, and thank you everyone for joining us again. Thank you, Emily, Nicole, and Rachel for sharing this important work with us as well. My name is Guadalupe Solis, and I'm a research analyst here at the Colorado Health Institute. And I recently joined the mental health ambassador team here at CHI as well. And today, as as Nicole mentioned, I'll be assisting my colleagues with the question and answers or Q&A portion of the webinar. So just briefly, if you are on your laptop, you'll see the Q&A bubble at the bottom of your little toggle bar. You can type in questions there. You can also type in questions in the chat as you regularly would. But yeah, who has our first Q&A question? I don't see anything as of now, but I'll give, we have one from Arden actually. Arden, would you like to raise your hand and one of our moderators can unmute you so that you can expand on your question if you'd like? Do we see a hand raised? If not, I could just go ahead and read the question from Arden for our group here. All right, I think I'm just going to go ahead and read it. So with gathering information, how do you address community, especially communities who are disproportionately impacted? Survey/listening, circle/engagement, oversaturation, and fatigue. So how do you sort of combat those while also serving the community, I think is what this question is getting at. Who would like to take that for us?
Yeah, I'm happy to take that. And then Rachel, feel free to add anything from your experience as well. This is definitely something that we were cognizant of. And I think part of the success of this program is that ambassador organizations are already very embedded in the community and they have a lot of these relationships already built. And so that felt like it made it a little bit easier to reach out to community members. And in terms of oversaturation and fatigue, I think one of the things ambassador programs did that made this more approachable is integrating mental health and immunization topics into their existing programming and taking more of a holistic approach that also talked about other resources that they provide, resources in the community, because we definitely heard about COVID fatigue, and we know that a lot of folks don't want to be talking about COVID anymore. And so we're having to find ways to still integrate this messaging with existing activities. And I think that has been one thing that has helped to address this oversaturation and fatigue, although we are definitely seeing this. And it's something that we're continuing to try to adapt and figure out as we continue the program.
Yeah, I definitely agree with Emily that, the existing relationships that ambassadors had made it easier to do things like the community survey or focus groups, but they were also really helpful in giving us feedback about, like oftentimes these listening sessions or surveys are paired with like an incentive, for example. So one really good piece of feedback we got was like we had like X amount of money to as an incentive for focus groups, and they said no, we don't want to do that much, because if you do this amount of money now, later when there's less funding and then there's less money for incentives, people will be like, I don't want to do it, I'm getting less money. So it's helpful to have their connections and like their long-term perspective on community engagement helps with even just small logistical things like that.
Thank you, Rachel and Emily. We have another question, and Arden, I did see that you raised your hand. Apologies, we weren't able to get to you, but if you have any follow-up questions, feel free to pop those in the chat or the Q&A, and maybe we could get you on the mic. But I'm going to move us on to our next question from Megan. Megan, would you like to ask your question? If so, you could raise your hand. If not, I could ask it for you. Let's see if I could actually see a hand raise this time. I'll give it a couple more seconds. Okay, no worries, Megan. So I'll go ahead and ask the question. How is MDPH planning to incorporate these lessons learned into their work? Who would like to take that question? Cole.
I'm back. Hi, everyone. My computer is completely frozen on the blue screen of death. So, hi. Thank you, Guadalupe. We plan to use these lessons learned to really assess and identify how we want to work on these programs for different future health topics and lessons learned. We're thinking about community engagement as a spectrum and what we need to do to be able to move this work forward in different ways, whether it's for different vaccines or for different health outcomes, and being able to really refine our current programming as we need to go. There's lots of lessons learned, and so we're excited to move this work forward and support others in that work as well.
Awesome. Thank you, Nicole. I have a question from Erica as well. Erica, would you like to unmute and ask, or raise your hand so we can unmute you and you could ask your question? Erica, hi. All right, I'll just go ahead and ask the question again. So was the funding structure for ambassadors similar for the mental health program to what we established in the COVID-19 vaccine program? How do ambassadors apply, if so?
Great question. So ambassadors can apply for our different programs in different ways. And so each program is structured in recruitment and identification of community-based organizations differently. And it really just comes back to your program goals. What are the things you're trying to look for? What are the priority populations? What's the capacity of the organizations you want to work for? For our mental health ambassador program, we are doing an interview process and currently in recruitment right now. And so we sent out a request for interviews and working through that with them. The funding structure is different for each program. I think that was the original part of the question. The dollars for COVID come through the CDC Foundation and some of our Metro Denver Partnership for Health partners, and to really work through flu and COVID vaccines specifically. The Mental Health Ambassador Program is funded in a different way, and each one has a different menu of options for working with us, and that includes different levels of stipends as well. So each thing really just comes back to your program goals. Each program comes back to who are you trying to target, what do you want to work for and work towards, and those are the things that you think about with your group and your partners as you work to identify recruitment. Great question. Thank you for that.
Yes, thank you so far for the really great questions. We have one also in the chat from Andrew Elmore. I'll give it a second here. If Andrew, you'd like to raise your hand. And there he is. Let's see. Go ahead, Andrew.
All right, thank you very much for putting this on. From the perspective of a public health organization, you know, we come up with lots of different plans, but what are some good strategies for partnering with community members and organizations to get that collaboration and feedback to make sure we're serving the community the way it wants to be served?
Emily or Rachel, do you want to chime in at all with any answers? Otherwise, I'm happy to take it.
Yeah, I'll go ahead and share from my perspective, and then Nicole and Rachel, feel free to jump in. Andrew, I think one of the strengths in the ambassador programs is that we've been able to partner with organizations who, to an extent, were already very embedded in the community. They represent the communities that they're serving. And so by partnering with them, that meant that we had that trust already built to an extent, which was really helpful. So I think it really starts with recruitment and the folks that you're working with in the program. I would also say that the structure of having both liaisons and ambassadors was incredibly helpful for building some of those partnerships. So our ambassadors were community-based organizations on the ground, and we partnered them with liaisons who were public health agency staff in the Metro Denver area to provide support and resources and subject matter expertise as needed to build partnerships between community-based organizations and public health. And the hope is that they both get support for the program and build those relationships to continue working on other health topics as well. I'll stop there and have Nicole or Rachel chime in.
Yeah, I agree, Emily. And I would say, yeah, this program was really focused on increasing the capacity of ambassador organizations to, for them to do the work in the community. But a secondary goal of the program, or the second goal of the program, I should say, is to make it more likely that ambassador organizations will partner with public health and healthcare partners in the future. So while this program was primarily focused on building the capacity of ambassador organizations, we hope that long-term the program strengthens partnerships kind of across the board. So if, public health is interested in getting feedback from community-based organizations, they can have this program as like a, this program built trust between those partners.
Nicole, is there anything you'd like to add?
No, thank you, Rachel and Emily, for that. We are putting, actually, I will add that we are putting together some best practices for working with community from all of our lessons learned that we can be able to share over the course of the coming months as we create our sustainability plan and model. So great question.
Awesome. Well, thank you, everyone. I don't see any other questions currently in the Q&A or the chat. But we are at 8:56, 4 minutes before 9. Thank you all again so much for joining us. Nicole, is it okay if I hand it over to you to wrap us up?
Yes, of course. Thank you everyone for joining us today and for your great questions and for your patience with my technology. I invite you to join us for next month's Eggheads. That will focus on CHI's initiatives for integrating systems of care. You'll learn about some exciting work that hasn't got a lot of attention yet, but it promises to make life better and easier for people who use all sorts of health and social systems. Thank you again for joining us today. We are very appreciative of that, and all materials will be sent out in the coming weeks. Thank you so much.